Hi, you guys. Welcome back for our daily practice questions. It is day 311, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm tested, when I'm talking about things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one, y'all. But before we get started, don't forget to go and hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description, and it houses all of the resources that I do offer. And I always like to direct you to my business profile by simply going to Google and searching the Nursing Studio. It will bring you here where you can find my contact telephone number, link to my website, and testimonials from previous review students. All right, question number one for today. A 68-year-old male with a 40-pack year smoking history presents with a chronic cough producing white sputum for 3 months each year over the past 3 years. Lung exam reveals bronchi that clears with coughing. What is the most likely diagnosis? Is it A, chronic bronchitis? Is it B, emphysema? Is it C, bronchiectasis? Or is it D, COPD Gold Stage 3? Take a moment and tell me what you got in the comments, y'all. All right, and I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis? And as I always tell y'all, if they're looking for a diagnosis, you need to run it back and look at the assessment findings because we got to know what it is to even be able to determine a diagnosis. We have to know what they are presenting with to determine the diagnosis. I should say it that way. So knowing their signs and symptoms, their presentation, so you can start to form your differential diagnoses. So we have a 68-year-old male, has a 40-pack year history, comes in with this chronic cough, is productive, sputum is white, and this goes on for 3 months each year, over 3 months each year, and has been for the 3 past years. And that is the key right there. The answer is A, chronic bronchitis. As chronic bronchitis, is categorized as having this productive, ongoing cough for 3 months for 2 consecutive years or more. So in this scenario, 3 months every year for 3 years is chronic bronchitis. All right, question number 2. A 33-year-old female presents with dysuria, urinary frequency, and suprapubic pain. The urinalysis shows positive leukocytes and nitrites. What is the most appropriate initial treatment? Is it A, Cipro for 10 days, B, nitrofurantoin for 5 days, C, Augmentin for 10 days, or D, Bactrim for 10 days? Take a moment and tell me what you got. All right, stem of the question states, what is the most appropriate initial treatment? Again, if the stem is looking for a treatment, you need to run it back and see if they provided you with a diagnosis. And in this scenario, they have not provided you with a diagnosis. So what do we have to do? We got to run it back a step further and look at the assessment finding so that we are able to determine a diagnosis. So we have a 33-year-old female that comes in with dysuria, urinary frequency, and suprapubic pain. Classic presentation for UTI, right? Now, the urinalysis shows positive leukocytes and nitrites, which confirms that, in fact, this female does have a UTI. So what is our first-line therapy treatment for this? It's nitrofurantoin. So B is your best answer, nitrofurantoin for 5 days, aka macrobid. All right, lastly, question number 3. A 59-year-old postmenopausal woman presents for a bone density screening. She has no prior fractures or family history of osteoporosis. According to the USPSTF guidelines, when should bone density screening begin for average risk women? Is it A, age 55? Is it B, age 60? Is it C, age 65? Or is it D, at menopause? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question states, according to the USPSTF guidelines, when should bone density screening begin for an average risk woman? And the age is C, age 65. So a female who does not have any prior fractures or family history of osteoporosis with average risk is at 65. And the only time that we do this earlier is for women who reach postmenopause at an earlier age. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can shoot us a text message or an email. And as always, everything that I do offer is linked in the bio of this channel, as well as all of my website details are linked in the description of this video. All right, y'all. Y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.